everyone. Thanks so much for joining us this week on the Mental Health Mukbang, where we talk about mental health in digestible bites. So my name is Jeanie Wang, and I'm a clinical psychologist in Houston, Texas. And today I'm eating a rigatoni bolognese. It's actually leftovers, but from a restaurant called Cultivare here in Houston.
That sounds pretty good.
I guess I'll go next. I'm Jeanie Chang, an LMFT in Raleigh, North Carolina, and I'm eating my favorite comfort food, Korean. In Korean, it's called tteokbokki. So in English, I would say spicy rice cakes. So I was just craving comfort food today.
We just have days like that, you know?
Yeah.
We can't hear you, Chris.
I forgot I had push to talk on. Well, I'm an LMFT from Houston, Texas, and today I've got barbacoa tacos. So I'm hoping I don't food coma immediately after this.
Dude, barbacoa tacos sounds delicious.
Yum.
All right, my name's Jed. I'm a therapist based out of LA. I made myself ramen and eggs again because, you know, comfort food, right?
Right.
All right, so today we're talking about therapy. So last week we talked about therapy from a therapist's perspective. This week we're talking about therapy from a client's perspective, and I guess trying to address as many of the questions that people have about therapy in the short amount of time that we have today. So we're going to try to pack a lot of information into a relatively standard episode length, and we'll try to cover as much as possible, but it's not going to be an all-inclusive we're not going to cover everything. So hopefully this gives people a good place to start when it comes to therapy. And so we're just going to get into it. First question, why do people go to therapy? Or why should you go to therapy?
I think that's the question that everyone always has, right, to start out, because so many clients, when they first enter my office, have spent so much time saying, I don't need therapy, right? But then when you see them, the first thought as a clinician is, you probably should have gone to therapy a long time ago, right? So for you guys, where do you think that, who is appropriate for therapy and why should people go to therapy?
Honestly, therapy is appropriate for anyone and everyone that wants it. I think that the thing that probably prevents someone from going, or admittedly saying, like your clients, and I've gotten those clients too, is perhaps stigma. There's always a stigma, right? And you say if you're going to a therapist, ooh, you might get, I want to say it's a lot less now, but yeah, to answer that question, everyone, any of us, we talked about it last time, right? That we've gone to therapy too. And so I think that's important to make that clear. It is great to go. It's very helpful. And we'll talk about finding the right therapist, you would hope, right? But yeah, for anyone who wants it.
I would say that I generally agree with Jeanie that most people probably would benefit, but there are people I think who are at risk with traditional talk therapy under certain kind of conditions, right? So if they are very unstable, if they are suicidal, if they have psychotic-like symptoms, then we may not be the first line in terms of treatment for you. So if you're hearing voices, or if you are seeing things that are not there, or if you have, kind of thoughts of wanting to harm yourself, then I would say therapists are not kind of the first level of care that we would interface with.
Right.
That being said, I think what Jeanie said in terms of if you're interested, if you're willing, then I think that's a great place to start. I think we also have to mention that a lot of people, when they come to therapy for the first time, they're really ambivalent about it. You half want to go, you half don't want to, because you're having to stir up all this junk that you've kept nicely packed away for a while. And so if you feel conflicted and scared, but yet hopeful, that's totally normal too.
Yeah.
So just wanted to kind of add that.
Yeah,
Love that.
I definitely believe in an integrative approach, right? So absolutely for higher risk clients, don't talk therapy alone probably isn't the best idea, but coordinating with PCP, your primary care physician, a psychiatrist, making sure that we cover all our bases because our clients' needs are first, right? And I think a question that pops up is, what is therapy even, right? And I talk about it as it's a guided conversation, right? And for me, I think that, like you said, most people can benefit from therapy. It's just important to really look at what your goals are. A lot of people think it's, oh, I'm in crisis, so now I have to go to therapy. But that's not it at all, right? You have premarital counseling. You have sometimes people come to just vent. Sometimes people need someone to talk to, a safe space to just, let go of some of their feelings. It's not just all about crisis management.
And I think going off of that, I think a big part of it is also preventative. You know, I think that if you feel like you're somebody who may have may get overwhelmed by your emotions from time to time, it's always good, like, when you're feeling okay, to come in to see a therapist, because then you can, I actually prefer it when people come in and they're relatively, like, they don't have to, like, I don't have to do crisis management, because then we can actually get to work right away, right, in terms of going to take care of, like, the deeper stuff. Because when you're in a more stable place, you can get into those deeper things a little bit more easily. So not to say that therapy isn't also for people who are in crisis. Like, we definitely do a lot of that work, and I think that work is also really important. But when it comes to, like, the like changing, like, the fundamental change that we want to see in therapy, I would say it's usually when the whole point of crisis, like, management is to do the crisis management so that we can get you stable enough to do the long-term, like, change that happens as a result of therapy. And so I think that's also really important to do, like the preventative stuff, or just, like, even if you feel like you're not, like, in direct need right now, anything that's not crisis management is also a good time to come. And I think, like Chris said, it's kind of adding on to what Chris had said. I think it's also a sounding board. Like, sometimes there's a lot of memes that I see about how therapists are basically just common sense filters. It's kind of like something comes in, and then we kind of, like, filter it and then say it back to you, and you're like, oh wait, hold on, that's not what it is. And then we're like, well, then what is it? So there's also that role that we play. Yeah.
Yeah, absolutely.
Can we share their perspective?
Yeah.
I have a question. So let's just say you have a client who, now there are some clients who get pushed into therapy. Maybe that's the client, the population I work with, teens, college kids, even fellow parents, even couples, right? The partner being pushed to come.
Yeah.
How have you guys handled that when one person might be all in for therapy and the other person's not, and you have to balance that?
Let's start with Chris, since he works with couples.
Yeah, I was thinking,
I have
Chris.
so many that come to mind. And that is true, because typically for me, it's one person has been wanting to go to therapy for 2 years or some lengthy amount of time. The other person has been avoiding it. They schedule, they cancel, they schedule, they cancel, they schedule, they cancel. And then finally, one person says, hey, divorce. And they go, oh shit, let's go to therapy, right? It's hard, because you have to play with the power dynamics a lot, and you have to create a safe space for both of them to really communicate. But the one thing that I'll say is, therapists aren't the agents of change. Our clients are, right? We can lead you to water, but we can't make you drink. We can't put in more work than our clients do. The best that we can do is sow seeds and hope that they take root and grow, right? So, I have clients, like you said, that are ambivalent or even resistant to therapy. And I do my best to connect with them and just, sow those seeds, try to give them a foundation, try to give them an outline. If you're not ready to do these things now, let's be realistic on how much effort it is going to take. And when you're ready, I'll be more than happy to meet you where you are.
That's awesome. I love that. Yeah. How about Jenny or Jed?
I think one of my big things is when somebody else contacts me about therapy for somebody else.
Yeah.
And that's happened a couple of times. I don't see couples and I don't see people under 18. So typically I don't get that often, but sometimes I will, where it's potentially a spouse or a parent. And I will basically write back and say, thanks for your interest, but kind of the client buy-in and their motivation matters more to me in working together. And so I will kind of throw it back and say, if that person wants to do the work, please have them contact me themselves. And when I do my phone consult with new clients, one of the questions I ask is, what is your motivation for therapy on a scale of 0 to 10? 10 being highly motivated, 0 being really not interested at all. And I ask that question for two purposes. One, for me to assess kind of how much they're invested, but also I want them to think for themselves, where do I stand on this? And if it's, a 5, I've had somebody say like, it's, like a 9 and a 3. And I'm like, interesting, right? And so we can talk about that ambivalence and do some psychoeducation about it before we proceed. And so that's one of the ways too I kind of address that with people, is asking that question and having dialogue about that before we even start working together.
Yeah.
I think for me, it's I also because I get a lot of kids, so it's parents bringing their kids in, and I think it's also hard to. For me, I do it a little differently. I will try to convince them that therapy is not that bad. So there's always a way to explain therapy to somebody in a way that they understand what it is, and that makes them more open to the idea. I also keep a bag of gummy bears in my office because if you've ever tried to get a 7-year-old to buy into something, if you have gummy bears, you're gonna be good to go. And it doesn't have to just be 7-year-olds, If you keep that like jar of whatever, it's an opportunity, like the way that we talk about food, right? It's an opportunity to open up a conversation. So if you have like a thing of chocolate or whatever, or one of those like variety bags of chocolate, I think anybody's like, you can ask if they want one. Just like, hey, like you can take whatever you want from this jar, right? And you think that it doesn't work after a certain age, but trust me,
it would work on me.
It works on pretty much any age, unless they don't like chocolate. In which case, like it's a little harder, but you can always bring up therapy in a way that makes it so that people are like, okay, like I'll talk to you for like however long it takes, and you take that opportunity to kind of rope them in.
Love that. Yeah. I was going to say, I work with a lot of parents too. And I don't know if you guys have been in this situation. By the way, I just dropped a spicy rice cake on my lap. So this is why I wore black today. Okay. It's all good.
All good.
No one can see what I'm wearing below. So I was going to say, parents have actually brought kids in, or teens in, most of the time teens, or even a college students. And I crack up at this. Maybe I shouldn't, but they'll be like, so he needs therapy, she needs therapy, but really they need therapy.
Yeah.
So, and you know how you have to divert that, because, and it's funny because they actually, and this is mostly Asian American parents who struggle a little bit with their own stigma of coming, and they bring their kid in thinking, okay, my kid will get the therapy, the therapist can fix them, that kind of thing. But I would say 50% of the time I'm saying, hey, so it sounds like I think you need therapy. I think this is more about you. And I've had to do that in just in a way that is obviously non-threatening and just more like, let's connect. I would love for me to get to know you, and then we can help your child. But I was going to ask you if you guys ever had to do that, where you've had to divert. Again, I work with more families, so there's multiple people involved. But with parents especially, yes, they will definitely come in going, you need to fix him, but then they end up talking the whole time, and I'm like, I think you want therapy.
Yeah. No, I get that a lot and court mandated court mandated clients, right? Anger
Oh, yeah.
management, CPS, things like that. Adolescence. When I was in juvie, nobody wanted to be there, right? Um, and that's another thing too, is I always tell them, listen, these sessions are for you. I'm not going to mandate what goals you work on, right? Your mom or your husband threw you in here and said, work on this. They need to work on this. No, that's not what we're going to do, right? It's what goals do you honestly want to work on? And also, I look at therapy like I look at relationship building like a house, right? We're not going to get to trust, which is like the roof or the windows, before we've built a solid foundation. So first, we're going to work on the basics, communication, right? Anger management, all these different things. Even knowing what emotions you're feeling at that moment, how to communicate that. All these basic building blocks. So yeah, I love it when kids come in and they tell me things like, yeah, my goal is to cuss less. I'm like, that's not your goal, man. Like, just tell me what you want to work on and I'll work with you. You want to play Jenga and talk? We can do that, right? It doesn't have to be just me and you on a couch kind of deal.
It's funny.
Yeah.
I don't know why we're laughing so much today, but I have the rice cake on the floor, so I don't want to go and get it. So then that brings up another, sorry to ask these questions, but it's good for people to know. Do you ever get those clients? And this is important for us to share about, we want to make sure that we have this safe, very safe space. And I've heard of people, clients coming to me saying, my fear is judgment, right? What I'm about to share. And then there's a lot of apologies. I see this more in women, I want to say, where they're like, I'm sorry, I can't help sharing this. And I'm like, stop saying sorry. No, I don't say it like that, but I'm like, I know that's in our nature, right? But have you had that experience of what do you do to almost comfort your clients that this is their space, their time, where we hope that it doesn't come across any judgment whatsoever. But I have gotten those clients where they've had that experience in therapy.
So you mean they've had a kind of previous negative experience?
Yeah, sorry, yes, not necessarily me. I would hope not, but they might tell me. But no, that they came in going, I felt like my previous therapists they were judging me, and that was the environment I had. So I'm coming in, and they're very apologetic. And I've seen more of that with college kids. So they're like, I'm sorry, I can't help getting mad. I'm like, you're mad. You don't say sorry for feeling mad, And I think that might be some of that. But I'm wondering if you guys have experienced that, and it might be the certain demographic I work with. But how do you create that environment where they don't necessarily have to feel like they apologize, and you're really trying to get them to, this is them to share what they want, when they want, to get the help that they want?
I think I also work with young adults, and I think that is also pretty common. I mean, it might just be an Asian thing. I work with a lot of Asian young adults too, and I definitely hear the, like, I just can't help it, or like, I'm sorry, like, whatever, something happened. I'm like, this is your space. Like, you can say whatever you want here, and it's just providing that validation for whatever it is that they're feeling, and then providing them with an explanation about why. Like, so for me, I guess one like recent example was somebody had come in and said that they were getting angry about something and they were apologizing, and was like, no, like, anger is about, like, emotions are valid things. They tell us a lot about our underlying values and our underlying feelings about what's going on. And so, like, feeling the anger is fine. Like, if you want to apologize for something, well, why don't we kind of explore that a little bit more, and why don't we talk about what's causing that anger, or what's driving that anger, and those usually turn into more fruitful discussions, as opposed to just being like, yeah, just don't be angry. But that's usually how I go about it, right? Like, offering that explanation and validating that experience usually opens up that conversation. And sometimes it takes a while, especially for people where it's been really ingrained in them, like whether it's because of the people they've interacted with in the past,
Sure.
and they're just used to having to apologize for whatever. Yeah, it's just helping them to learn that, hey, this is a place where this is your time. This is about you, and you can say whatever it is that you want to say. I am not going to be personally offended by whatever it is that you have to say, even if you're angry at me. So, I don't know. What about you, Jeanie?
Yeah, Jeanie, you mentioned that you see this sometimes with women as kind of a prevalent issue, and I only work with women, and it comes up so often. And one of the things they're often apologizing for is crying. And they'll say, I'm sorry, I'm crying, I'm sorry, I'm so upset. And I just want to be like, please don't apologize, right? And I'm like handing them a box of tissues, and I'm like, let's just sit for a moment. Like, let's sit with that, you know? And when I hear that, it makes me kind of so heartbroken, because it just makes me think, have you had to spend your whole life protecting others from your emotion, right? So much so that you're paying somebody to be there with you in them, and yet you're still trying to protect them. I mean, that's crazy to me, you know? And so there's a lot of apologizing for crying. There's a lot of apologizing for, I'm sorry, when they feel confused and they can't explain things in like a logical way, and they'll say, I'm sorry, I feel like I'm talking in circles. And I'm like, that's okay. This is so confusing, right? And so, yes, it comes up so much. And I think part of what we do as therapists is we're trying to help people relate to their emotions differently, right? And so when they've related to it in these really negative ways, right? Like anger is bad, sadness is bad, anxiety is bad. I'm like, whoa, no. These are all trying to just inform you.
Mm-hmm.
And they're not bad or good. They just are.
Right.
And so I think we have to really work with people to dispel some of that and change those relationships with emotion.
Yeah, that's really important to me. I want to hear Chris's thoughts, but that's what I want the clients to hear, that this is so to really own your emotions too, because that's part of the process of healing. But I do see a lot of apologies. Or do you ever get the apologies of, I'm sorry, I feel like I'm bashing this person, or I don't mean to make my mom sound bad. And
Right.
I get that a lot. And I think, and I don't know the specific demographic Jeanie you work with, but not just women, but specifically in our Asian culture, I will see that. But I want them to be free, because that is part of the process, right? So clients understanding that's just you said dispelling, just pouring that out. And we'll talk about processing soon. But anyways, I'm going off on a tangent, but yeah, just wanting clients to understand that this is for you. So yeah. Chris, what about you?
I mean, when we talk about emotional validation, it's okay to have feelings, right? It is important for us to it's okay to express those feelings. It's just important not to like lash out at people, right? Um, the way that I'd like to explain it to clients is that right now you're trying to logic your emotions, and emotions are inherently not logical, right? They're two completely different things. So stop trying to apply the two together. And two, it's okay to have multiple emotions about any given subject, right? I have two little sisters. I love my sisters. If they were in front of a moving train, I would absolutely push them out of the way and do everything I could to keep them safe. But sometimes I want to smother them with a pillow, right? That doesn't mean I hate them. I have multiple feelings about them, but in the end, I still love them. And that's what I hear a lot of times of like, I feel so bad because I'm bad mouthing this person. It's because of the fact that you're getting caught in that all or nothing thinking. Because you feel this type of way, that means you hate this person. No, you love this person, you want them to be better, you're just frustrated at this very, very specific, minute piece that's going on right now. And that's okay.
That's a great example. I hope your sisters are hearing this.
Yeah, I want to smother them all the time.
At least you're upfront with them and they know.
That's a great example. And sometimes I say, hey, it's not about your emotions. I actually care about what you do in that anger. I would like you to be able to, we can discuss what that anger can look like, so it's like separating behaviors. We're talking about CBT. Speaking of which, to wrap up, I was going to ask, do you clients come and ask you specific modalities that you practice? sometimes you get that, right? Clients are like, can I hear about what your methodology is? Or I tend to get that when you have college kids, right? And they read up on stuff, and I'm wondering, do you pronounce formally? Do you pronounce formally, hey, I am a CBT therapist? Or, because I know Jed said that earlier, but do you guys do that?
I don't. I mean, I tell them, like, hey, this is the way that I like to do things sometimes, but I don't try to lock myself into, like, I only do CBT, you know? Because there's a lot of stuff that happens during therapy, and sometimes it doesn't fit nicely within my CBT model. So sometimes you just got to adapt, you know?
Oh, totally.
Yeah, and I think traditional like psychology training and theory and practice doesn't always apply to people of color. And so I think that's extremely important that, a lot of these modalities were tested on white people, like, let's be honest. Right. And so they might be scientifically backed, but it doesn't mean that they apply to all types of people. But yes, people do ask. And if they have very specific, like they want to treat their anxiety, or if they want to do certain things, like there are probably more modalities that might fit that maybe will be helpful. At the same time, I kind of tell them that I'm happy to teach skills, but I'm also the type of therapist who wants to know what these symptoms are reflecting, in the sense of what brought you here. And so I will ask you about your past. I will ask you about patterns of relationships and how you coped in the past. Because I don't think that we can, in 12 sessions, CBT your way out of a lifelong history of depression. We can maybe give you some skills and you can manage better, but it's going to come back, 99% of the time. So let's talk about what brought you here. And so that, I think, is really important.
I like that question. That's the question I actually open up with. What brought you here? It's so general. They're like, where do I start? I go, start wherever you want to start. Yeah. Chris, you were going to say something?
I just start with, the question that I always start with is, how do you envision therapy, right? So what are their preconceptions of how it's going to go? What questions do you have for me? And like I said, I'm a very fluid therapist. I definitely have certain modalities that I gravitate towards, narrative, emotionally focused, things like that. But I'm also very fluid, so I tell them, if you want to be more structured, I can try to be more structured. If you want to focus on this, let's focus on that. If I'm going too hard, if you want me to go harder, just let me know. I'll work with you at your pace. And if we're not a right fit, right, that's a key point. If we're not a right fit, that's absolutely okay. Shop around, find another therapist. I'll even try to refer you to someone that might be a better fit, right? Because again, I have to make this point, is that when we've looked at research of different modalities of therapy, the vast majority the way that you can tell therapy is going to be successful, like 70% is therapeutic alliance. Whether or not you and your therapist get along and you feel like your therapist understands you. That is what is most important, not necessarily their training.
Speaking of fit, actually, oh, sorry. I cut you off.
You're good.
No? Okay, so speaking of fit, right? I think we probably should have asked this question or covered this question earlier, but it just came to mind. How do you find a therapist who fits you? And how do you know what style your therapist, like what kind of, or what style of therapy your therapist does, I think if we're gonna say that this episode is about what therapy means, like therapy for clients, right? And their perspective on it, I think that's one of the biggest questions that everybody always asks, like, how do you find one? And how do you know that that therapist is a good fit? So does anybody want to try to give that a go?
I think, okay, this is a huge question, so I'm trying to narrow it down. But I think since we're talking about Asian American mental health or Asian mental health, I think we need to talk about some of the questions you might ask a potential therapist, which has come up for me, where people will say things like, what is your experience working with people of color or Asian Americans? How do you think racism plays into mental health? These topics, I think, are now becoming more in the mainstream, where maybe people are knowing to ask these questions of therapists. But I don't feel that when I was even looking for a therapist early on in graduate school, that was even a conversation I felt like I could have, because most of those people were white. And so I think as an Asian American, if I were looking for a therapist, I would be curious, regardless of that person's racial or ethnic identity. I would be asking questions about how do they understand how, right, Asian identity interfaces onto mental health, or immigrant experience interfaces onto mental health, or being a first, second generation, part of Asian diaspora. How do you understand that, right? And do you think there's even a relationship? And so I think that's one of those things that comes up so much in conversation and on social media, is like, how do I find a therapist who's culturally humble
Words
enough,
here. Yeah.
right? Humble enough
humility.
to go there, or culturally, I don't want to use the word competent, but
Sensitive.
yeah, how do I find, yes, exactly, sensitive, that fit in that sort of way? And we're just talking about one component of fit. So I'm alluding to that piece. But you're entitled to ask those questions. And if you don't get the answers that you feel make you feel safe and comfortable, move on, right? Yeah. If they're like, I treat everybody the same, everybody's experience is, like it doesn't really matter who you are, who your identity is, where you grew up, what your parents' experience was, then I'd be like, okay, I'm moving on, So that's one piece when I think of fit, with that question.
I think that Jed asked a really good question, and I think just for the sake of our mukbang show, we are going to focus on Asian Americans, just because I think it's just easier for us to answer. But I was going to say, I ditto to everything Jeanie said. For instance, don't you shop around for the best scenario I can give you? You shop around for a doctor, right? When you move to town, you're finding the best dentist, pediatrician for your kids, your primary care physician. Therapy should be the same way. You ask, you interview, you ask tough questions. You're right, Jeanie. Those questions will be much more specific. I think people don't ask them. They're a little like, oh, but here's the one thing I wanted to bring up as a therapist, there's a fine line between what we do and self-disclosure. But self-disclosure I'll bring into play to enhance the therapeutic alliance, meaning especially with parents. They don't necessarily know that I have kids, but I will say, oh, you know what? I get it. I have 4 kids. That's my one bit of self-disclosure, where I get a little bit of that credibility that they may need to feel that comfort of, okay, she understands the space I'm in. I'm a parent. She's a parent, that kind of thing. Mm-hmm. So I wanted to bring that up because I think I will do that to connect. And Chris talked about 70% of the therapeutic alliance, hands down, so important. And so I will disclose that when I feel the need. Usually they don't even ask. Sometimes I wish they would ask tougher questions like that. Like, do you have kids? Or, do you understand this? Were you a second generation? But you don't get that as much. So I hope they're hearing this. Clients are hearing that they can ask those questions. Be tough on your therapist, just like you would on a doctor or a dentist, right?
Absolutely. I will say that if you're having these hesitations, that's what we created the group Subtle Asian Mental Health for, right? Ask those beginner questions and we can help teach you how to advocate for yourself, right? Write an email get a brief consult, talk to them, feel it out. See, the biggest thing is, do you feel heard? Do you feel validated? Do you feel like the therapist is at least attempting to understand? I know we're talking a lot about cultural fit, but also understand that I work with a lot of clients that I am not necessarily familiar with their culture, right? I work with trans, gay, lesbian, veterans, elders, adolescents. I work all over the spectrum. And I will say that, a doctor who's curing cancer doesn't necessarily have to have cancer in order to heal you, right? But he has to understand, he has to be trained in these different things. So just because if you're in an area that you can't find someone that looks like you or had the same history as you, that's okay, as long as they hear you, That's the key.
Yeah, I totally agree. I think because I have a white therapist, but she can go to those places with me in terms of racism, in terms of systemic injustice. And so it feels safe, right? It feels like she can hold space for that. But if she was like, not able to go there, right, with me emotionally or even cognitively, it'd be really hard to feel like I could bring those up.
Right.
And I will say that your therapist doesn't have to have the same viewpoints as you, right? Your therapist can actually be like, they can think differently, but they need to be able to create that space for you regardless of what their own opinions are, right? I mean, there are plenty of situations where like I personally, at a personal level, I disagree with the choices that my clients make, right? But that's not that doesn't mean that I can't be a competent therapist for them, right? I have my own personal reaction to whatever it is that they disclosed, but that doesn't mean that I'm not trying to process it for them at their level, right? Where they're coming from. I ask questions. I try to understand, hey, like, what does that mean to you? Or like, how does that affect you? And what does that look like for you? And how does that influence your thoughts and feelings and behaviors, right? Because at the end of the day, it's not about me as a therapist. And so if your therapist is talking about themselves a whole lot, I would just say, like, it's probably a good sign that you don't want to be there.
Right.
And yeah, somebody who will redirect the focus back to you, because this is your time that you're paying for, right? And if they're not making that time about you, then like what's the point, right? They can just go teach at a university and talk about themselves all day, because that's an appropriate place for that, and you can pay them in that circumstance if you want to. But in therapy, it's about the client, right? And so find a therapist who isn't talking about themselves all the time. Find a therapist who listens to you, who tries to understand where you're coming from. And you may never
actually out there, those kind of therapists.
Yeah, they're out there, right? I mean, not all therapists are like that, but it takes some time to try to find.
Sure.
And I guess that leads us to like finding a therapist, right? Where do you even start? I think that's another really big question that people have. Like, where do I even go to find a therapist? Like, how do I even start looking for one? And then comes the question of like, how do I pay for therapy?
Yeah.
So
I think when it comes to some of this stuff, we may go in depth, even more in a later episode. But for sure, places to start there are directories, right? We have our own directory on our website in the description box, right? Of Asian American therapists. Your Psychology Today. Call your insurance. If you need to go through insurance, call your insurance. That's a big one, because a lot of therapists are self-pay, private therapists at least. There are nonprofits that you can Google, find, that specialize in different things. And then if you need sliding scale, call those nonprofits. A lot of times they can refer you.
Also, graduate students or or universities sometimes have counseling that's also sliding scale. I was going to say, sometimes I say ask friends that you've heard have gone to therapy, and you're like, hey, he was really happy with this therapist. That might be somebody for me, just to start there with recommendations of your friends.
Absolutely.
I can probably go a little bit more in depth, just because I did community mental health for a while. Part of what I do is just sending people to therapy, even if I'm not seeing them myself, right? So in most states, or here in the States anyway, most places have community mental health centers that are funded by the government. And so if you have Medi-Cal, in California, if you have Medi-Cal, or in other states, whatever it is, whether it's Medicare or whatever they call their general, like, you can't afford regular health insurance, this is what you get.
Medicaid. That would be Medicaid.
Yeah. Okay, Medicaid coverage. There are places that only take Medicaid, and they charge you basically nothing, based on whatever your income is. And so a lot of people who work there, at least in my experience, tend to be people of color. So that's usually a good place to start looking. I mean, here in LA, we have multiple agencies that provide Asian-specific therapists. or Asian specific staff. Like there's yeah, I've applied to multiple of those. But yeah, like they exist out there. I know California is kind of an exception because we have so many Asians out here, but I've met a lot of really great therapists who work in community mental health who aren't necessarily Asian but are very competent, and are. I've also met some that are not so much. So you really have to kind of like, it is going to be like hit or miss. But the great thing about community mental health is that you can always request a new therapist. They usually have multiple therapists on site, and if you don't like the one that you're working with, you can just try another one. And if you don't like that one, you can request a referral out to another community mental health center. And so there are a lot of resources, I think, that people just don't know are out there. And going back to what Chris had said about calling your insurance provider, every insurance provider has a directory of providers that you can find online. And so just go to your Google your insurance provider and then provider directory. So if you have Cigna, you Google Cigna provider directory, and they will have like a drop-down list in your location, like near your location, of a bunch of professionals, and that will include like LCSWs and mental health professionals. Sometimes the wording is a little bit different for what they call their mental health people, but you can generally see them as like social services or mental health or some kind of licensed social worker or whatever, and they'll have a whole list of people that take their insurance and are on their insurance panels. And so that's another way to start looking. And I don't think that people know that they have that directory available to them, right? Like, yeah. For you guys, right? When you get your insurance packet, you don't
even look at it.
You don't look at it, right?
I do.
I'm like,
they send
nope,
you like
sorry.
a thick,
Yeah.
they send you a phone book that's like this thick of providers in your area, and you're just like, oh, that's trash, and just toss it, right? Because you already picked your doctor or whatever. But the reality is, like, there are a lot of providers that are available on insurance, and
it's also listed online, right? You can do it online. I was going to also say don't underestimate your primary care provider. Mm-hmm. Your doctor that you've been going to, they probably have a list of recommendations they work with that could help with integrative care. But I have found word of mouth pretty successful, as in someone recommending somebody else to somebody else, and that works too. Mm-hmm. But yeah, any last words from Jeanie?
Don't be discouraged. Because I think, as Jed was talking about insurance panels, like, I have so many colleagues who are on, Blue Cross Blue Shield or United Health, and they're full. And they're telling me that it is almost impossible to update their profile to indicate that they are full. So right. They sometimes don't have the capacity to call you back or email you back. And that may feel frustrating if after a whole list of 10 people, 6 of them haven't called you back. But don't give up. And it's going to take a lot of maybe just initiation and motivation on your part, but don't give up, because we're here. We just don't know how to find you. You have to find us.
Yeah. Wow, well said. And that made me remind myself one more, depending on who's watching this. If you're in the corporate space, like you work for an organization, they have EAPs, employee assistance programs, so they can provide free therapy through your own workplace. Don't hesitate to use that as well, because first of all, some of it's free. I think you get 4 to 8 sessions free. I highly recommend that. And it's through your workplace, so you know that they're covered and everything like that. So that's something to think about as well. And if you want to continue more, then you can find another therapist. Yeah.
When it comes to how you mentioned schools, if you're going to school, you have a school counseling program, right? But if you're not in school, if you have a university or a college that has a master's program for therapists, go to their practicum. They are always needing clients for their students, and they're practicing under
a
supervisor. Yeah, that's where I got my training. So you'll absolutely still get
cheap.
Excellent care. Yeah, and it's like $5. They're
okay, maybe not $5, but
ours is 10 a session. $10 a session.
Wow, you guys were okay. Ours was 30.
Ours was 15.
Wow.
Rich people, relax.
15, well, 30. No, it wasn't. It was okay. Maybe I'm wrong. Maybe I need to call my graduate school. I forget how much it was. Maybe it was 15. Okay, all right. Your face shows it all. Maybe it's not 30. I gotta find that
Ours
out.
was like
but,
15 to 25 on a sliding scale. So
Yeah.
but hopefully this is helping. I know that we need to wrap up, but yes, I love Jenny saying being patient, because there is quite a need for therapists, and especially if you're on the insurance panel, sometimes you are very full and you can't get in. And I've heard a lot of people frustrated and complaining about that when they really need the help. So, but there are many options, as we hope we've shared. And so if there's more questions, you can reach us through. Where can they reach us? Asian Mental
Facebook.
Health Collective
Yeah.
on YouTube. We're here, but we hope that we made mental health easily digestible. I will pick up my spicy rice cake now, and hope to see you guys next time.
Yeah. See you all next week.
Bye.